At Walgreens, one of our companies is called Take Care Health Systems, and Take Care has developed a enterprise solution for companies that not only touches the folks that work at corporate on-sites, but all their dependents and others throughout the United States by taking our 7,000 points of care, which are the stores and our clinics and health centers, along with the 68,000 healthcare professionals that we employ at Walgreens, and have created a holistic approach to healthcare so that people have access and affordability and convenience. Since most people live, in fact 68% of all Americans live within 5 minutes of a Walgreens, we're in a position to provide these healthcare touch points, whether they be a pharmacist, whether they be a healthcare clinic inside of a Walgreens, and combine them with the worksite health centers, whether they be occupational health, whether they be at headquarters for primary care, chronic care, in some cases we do optometry, dentistry. I think bringing that together along with a very transparent discounted prescription pricing program that is customized to each company and then allows all people that are employed by that company and their dependents to go into a Walgreens or go into a pharmacy that we would place at a corporation if they so choose, and get their prescriptions at a discounted price, but also at a transparent price. And I think more and more healthcare has to go transparent, and we're pushing that very aggressively. They care about the people they employ, and I think when they focus on their people, there's a natural outcome, which is a better bottom line, and there's a healthier bottom line, a healthier workforce. They're not mutually exclusive. In fact, quite the opposite. And in today's environment, people are being asked to do more for their company. There's fewer people doing more things, and I think companies have a responsibility to focus on the health and well-being of the people they employ. To me, I don't care if you're a low-wage employee or a high-paid employee. Frankly, you're a human being, and we need to find solutions for everybody, regardless of what their compensation is. And there are solutions. I do not believe that you cannot have affordable, high-quality, accessible health care. In fact, that's what our company's built on. When we started putting in clinics inside of Walgreens, it was done to close the socioeconomic gap in health care. Since then, we made a couple acquisitions, and now we're doing it on a large scale with corporations as well. But we had to be creative. We had to whiteboard it because there's, frankly, a system we all know that's broken, and to try and improve on a broken system really gets you nowhere. So we've recreated the system in itself. Workforce health challenge is like any other challenge that a company has. It's one aspect, and I think the key is to focus on what are, in fact, the benefits that you get from engaging the folks that are part of your company, and how do you truly focus on their needs, and how do you look at people as individuals, and what is the best approach for each person. Everybody's different. Everybody wants something else. People don't want to be told what to do. People want health care on their terms, not the system's terms. And so the idea is to try and create an approach and an offering that addresses the different needs of the different types of people that companies employ. I think a lot of cost is going to come out of the system. There's too many hidden costs. I think the light of day is going to be shown on a number of them. It's going to disrupt a lot of companies, a lot of folks that are in the healthcare space, but that's what's needed. We can't continue with these healthcare costs. So there'll be a new approach to healthcare, something that I'm not sure anybody really knows what it is, because to do it right, I don't think you can know what it is. So I think there's going to be a period of time right now. I know we're stepping back away from it all, especially in the area of chronic disease, and coming up with a whole new approach that doesn't exist today because, frankly, we don't believe that the approaches to disease management have been having the effect that they need to have on reducing the overall cost to the individual, to the company, and especially the health and well-being of a person who is in a chronic disease state. Anything that's going to make it easier and simpler and convenient and affordable is the only way that people are going to take advantage of what's out there. And technology is certainly an enabler. I think we'll be seeing people using their phones in ways they've never used them before, their mobile phones. I've seen some technology there. I think we're going to see other types of devices that will provide vital signs to the right people at the right time, at the right cost point. You know, obviously, information and getting information to people. I mean, it's no surprise that when you look at what's one of the best sellers on Amazon.com, it's Merck Medical Manual. People are taking things into their own hands. They want to know. I mean, we as individuals have an insatiable thirst for knowledge, especially when it comes to healthcare, because it is not accessible right now. It's not affordable, and it's certainly not convenient. Well, what's convenient? Going online, reading, having various touch points. Government has its place, and as long as they're an enabler to reducing costs and having more people get access to care and get access to information, all the better. Pushing things down people's throats is not going to work.